Hello, this is Ashlyn Whitmore and Leanne Norton talking about why an antibiotic will only treat a bacterial infection and not viral infections, and specifically the antibiotic Keflex.
To start off, let us introduce you to Rhonda. Rhonda Hypochondriac is a 28-year-old female that has recently been experiencing respiratory concerns and comes to the clinic demanding an antibiotic. Her symptoms include a non-productive cough, chest congestion, crackles to bilateral lower lobes, a fever of 99.9 not relieved by Tylenol, and overall fatigue and malaise. Dr. Johnson reviewed her allergies prior to prescribing and notes that she is allergic to penicillin. With this information, Dr. Johnson determines that Keflex will be the best antibiotic to prescribe to her, as patients with a mild to moderate allergy to penicillin are able to take Keflex. He gives her Keflex 500 milligrams by mouth 4 times a day for 10 days.
Now let's talk about what Keflex is. Keflex is a semi-synthetic cephalosporin antibiotic that has antimicrobial activity. It is used to treat mostly gram-positive bacteria, but also some gram-negative bacteria. Infections caused by these bacteria are laryngitis, bronchitis, and pneumonia, as well as other non-respiratory infections such as otitis media, skin infections such as cellulitis, and UTIs. Some bacteria types that Keflex treats include, but are not limited to, Staphylococcus aureus, Streptococcus pneumoniae, and Streptococcus pyogenes.
Here is a 2D model structure, rotating 3D structure, molecular formula, and IUPAC name.
Let's talk about how Keflex works once it is prescribed. Keflex works by binding to and inactivating penicillin binding proteins that are located on the inner membrane of the bacterial cell wall. Penicillin binding proteins are enzymes that are involved in the terminal stages of assembling the bacterial cell wall and also in reshaping of the cell wall during growth and division. Inactivation of penicillin binding proteins interferes with the cross-linkage of the peptidoglycan chain necessary for cell wall strength and rigidity. This then results in weakening of the cell wall and then causes cell lysis.
So now that we know how Keflex works, let's go back and check on Rhonda. 3 days later, Rhonda returns to the clinic. Dr. Johnson thinks it would be best to run some tests to find out what the true cause of her illness is. He orders a CBC and a rapid nasal swab test. Upon results of the tests, it is shown that Rhonda has type B influenza, which is caused by a virus and not a bacteria. Therefore, Rhonda has not been getting any better with the antibiotic. But why?
First, we need to know that a bacteria and a virus have different mechanisms of replication and therefore different structures. Like shown in the previous video, a bacteria has a cell wall containing a peptidoglycan chain and a virus does not. It instead has a protein shell called a capsid. Keflex is an antibiotic, like stated before, that attaches to the penicillin binding protein in the cell wall, causing cell lysis. But being there is no penicillin binding protein, it cannot attach, meaning no cell lysis.
Rhonda is now upset and wants to know what Dr. Johnson can do for her. Dr. Johnson explains to Rhonda that unfortunately, she just needs to rest and drink plenty of fluids to overcome the virus.